Cuirmagad the Lascan Corla. Last Friday, the head of our National Screening Service, Fiona Murphy, posted the following words. Amazing to be part of this. I never thought when I started in healthcare a long time ago that it would be possible to eliminate a cancer, especially one that was increasing. Now we will see it in our lifetime. Remarkable. Kim, a patient advocate, described how much it meant to her to be at the event, having herself had cervical cancer. She said, to see the progress that's being made in eliminating this cruel disease is really something. On Friday morning last, clinicians and patient advocates met to launch our roadmap to eliminate cervical cancer. We're only the 4th country in the world to announce such an ambitious target. The launch is so significant and it is so positive, and yet I didn't see a single comment from senior figures in Sinn Féin to mark this momentous day. In contrast, the Sinn Féin motion talks about throwing in the towel. We've just heard Deputy Doherty talk about throwing in the towel. Throwing in the towel is collapsing the Northern Ireland Assembly in the face of Brexit nearly 7 years ago. So how has that worked out for patients in Northern Ireland under Sinn Féin? Hospital waiting lists in the south used to be longer than they are in Northern Ireland, but not anymore. In fact, the lists in the south are now half what they are in Northern Ireland. And for patients waiting in the south for over a year, the list is 10 times shorter in the south than it is in the north. That's what throwing in the towel means. It means walking away from the people of Northern Ireland when they needed leadership on the economy and on public services like healthcare. That's what throwing in the towel looks like, and that's what throwing in the towel does. So let's go back to last Friday. After we launched the plan for the elimination of cervical cancer, I visited the new outpatient building for the Rotunda Maternity Hospital. The building is just off O'Connell Street. It's a €45 million investment by this government in a state-of-the-art women and infants healthcare facility. It's going to transform care for women and children for decades to come. Again, not a single word from Sinn Féin. Instead, Sinn Féin's motion tonight is describing things as disastrous. To read the Sinn Féin motion and to listen to some of the contributions, you would be forgiven for thinking that there isn't a doctor or a nurse working in Ireland today, that they've all left the country and that nobody abroad wants to come here. The truth, of course, is very different to that. The truth is that babies born today will reach adulthood in Ireland where we expect to have eliminated cervical cancer because we have been hiring more doctors, more nurses, more health and social care professionals than ever before. We're in a position to achieve this ambitious target thanks to the incredible dedication of those working in our health service and the support of the patient groups. The truth is that we can provide new services for women and infants from new facilities because we have expanded the workforce. The truth is that the waiting lists fell last year for the first time since 2015, and they are on target to fall again this year because of record levels of recruitment for 3 years in a row. Since 2019, we've increased the number of doctors working in the HSE by more than 2,500. The number of consultants in permanent posts has gone up from 2,600 to 3,500. We've increased the number of nurses and midwives by nearly 7,000. We've increased the number of health and social care professionals by nearly 3,500. And we've increased the number of non-clinical staff by more than 10,000. So deputies here very understandably have spoken about their local hospitals, Letterkenny, Limerick, Kerry and others. Those hospitals have never, ever had the level of investment that they've had over the last 3 years. They have never had increases in their workforce like they've had over the last 3 years. And next year, we plan on increasing the workforce by several thousand more. more nurses to roll out safe staffing, more clinicians to open more hospital beds, more intensive care beds, more community beds, more professional staff to speed up the pace at which we can build new beds, new primary care centres, new hospitals, more digital professionals to help us roll out digital health services to patients. In fact, the HSE has been hiring at such a pace that they reached their full hiring targets early this year. So, of course, having filled the posts that they are funded to fill, which is the third record year of recruitment in a row, at that point they stopped hiring. That's how it works in every school, every Garda station, every local authority, every business. You have money to hire this many people. When you have hired that many people, you can't hire more people. That's how it works. Yet the motion before us here tonight describes this approach as disastrous. Incredibly, the motion decries the mismanagement of the health budget, presumably a reference to the HSE spending more money than it was funded for because they treated a record number of patients. The motion decries the mismanagement of the health budget and then goes on to demand that the same HSE hire into a bunch of posts that they're not funded for. You can't have it both ways, deputies. Which is it going to be? Do you want proper financial management, or do you want the HSE to just hire into thousands of posts for which it isn't funded for? When I speak with health ministers around the world, many of them tell me that their biggest challenge is an inability to hire doctors, to hire nurses. In Ireland, by contrast, we are hiring at record levels, and we have exceeded the already ambitious targets for this year. Where I agree with the deputies is that there is absolutely no question, but that many of the jobs in our healthcare service are very intense jobs. They are tough jobs, they are difficult jobs. Working in emergency departments, working in intensive care wards, working in complex surgery, to name but a few. There is also no question, but that we must all strive every day to do better and better for patients, and do better and better for our fantastic healthcare professionals. That's why we set up the NCHD task force. That's why we hired a chief health and social care professional. That's why we're rolling out safe staffing through next year. That's why we're continuing to invest in advanced practice. That's why we're investing in new primary care centres and new bed blocks and new hospitals. That's why we've been hiring at record rates for the past 3 years, and that's why we're expanding healthcare college places. It is also true that the vast majority of healthcare professionals I speak with talk with passion about their work and about their patients. They talk with pride about their hospitals or about their community organisations. It's true that the vast majority of qualifying healthcare professionals in Ireland choose to stay and work in Ireland. And some do go abroad, as is normal and natural and healthy. And it is also true that the majority of those who qualify here and choose to go abroad in time choose to come back home and to work here. We are very fortunate in Ireland to have such high-quality healthcare training and education. We are very fortunate that so many internationally trained healthcare professionals choose to work in Ireland. They've been doing that for many years. They'll continue to do that next year, whilst we expand again by several thousand the healthcare workforce. This government will continue to grow our healthcare workforce. We will continue to invest in our healthcare workforce, and we will continue to support in every way we can our fantastic healthcare professionals to be the very best professionals that they can be. Gur Magat.